In the history taking of a patient, we have to first jot down what is called the particulars of the patient, which includes the name, age, gender, address, religion, occupation, marital status, sometimes, not all the time, whenever we feel it is relevant, and the date of admission to the hospital and the date of examination of the patient. Now, when we present it, all this has to be said in one sentence, like Mr. ABC, 50 years of age, from New Delhi, who is Christian and a doctor by occupation, was admitted on the 1st of December 2021 and examined on the 5th of December 2021. When I said that whole sentence, I did not mention that the patient is a male because I said Mr. ABC. Similarly, for females, you can say Miss XYZ or Mrs. XYZ. This in itself describes that the patient is a female and whether he or she is unmarried or married just by seeing the title. And so, coming to the chief complaint, this has to be in a chronological order. Chronological order means that we have to tell the earliest complaint first. When a patient comes to you and you just ask him what's wrong or what are your complaints, they might say that I have severe headache since 2 days and I also have fever for 5 days. But this is not the way to write it. We'll have to write fever first because that occurred earlier and then the headache. We don't write it in the order presented by the patient, but in a chronological order after getting to know all the complaints of the patient. So these are the chief complaints. And then the history of present illness will always start as the patient was apparently well 5 days back when he developed fever, which was, and we have to describe a few points about fever, like the grade of fever, the type of fever, type as in did it occur at night or in the morning or all day long, or did it come on every third day or every fourth day, and was it associated with sweating and chills and rigor and things like that. Similarly, for pain, we'll say that the patient had headache, which was, will describe the onset, progression of pain, type of headache, severity, periodicity. Did it occur all day long or was it only for a few minutes in the evening? Things like that. And for pain, we always talk about three things: shifting of pain, radiation of pain, and referred pain. We also have to mention about aggravating factors and relieving factors. And we have to ask about other associated symptoms like nausea, vomiting, difficulty in breathing, or whatever we feel is relevant depending upon the chief complaints of the patient. Like, for example, if someone complaints of pain in the lower abdomen, we have to ask about urinary symptoms also, bowel symptoms also, loss of appetite and loss of weight and everything. After all this is done, whatever is present is the associated symptom, and whatever is absent is the negative symptom, and we have to mention that these are absent, and that is very important. After this, we also need to mention the course progression of all these symptoms, or the treatment, if the patient has taken any treatment before the date of admission. Before coming here, has he or she taken any over-the-counter drugs, or has gone to another doctor or hospital and got any treatment over there before that. And also after admission, so admission, so before admission, was there any treatment? And after admission, what has been going on in the last 4 days after admission, because we are examining the patient on the 5th of December. So that is also very important. So that is the course of treatment, whether it is before or after the admission. That's important. Let's say a patient came with severe pain, abdomen and fever, and we're examining the patient 10 days later. So we'll tell the history about the patient had severe pain, abdomen and this and that, and patient had very severe fever and was dehydrated. And but then after admission, the patient received antibiotics and IV fluids and was kept nil per oral, and the patient improved after 4 days of all these medications. And that progress of the symptoms is what we want to know over here. After this is the history of past illness. Here we will ask the patient if he or she had any similar illness in the past, similar symptoms in the past, or any relevant history, like any significant illness. Someone could have had an ear infection in the past, so for which he or she was hospitalized and treated. So we need to mention that. Apart from this, we are not going to ask every patient if they had any eye problem, ear problem, tongue problem, headache, or things like that. So if present, we will mention that. If not, nothing about it. But we do need to mention if the patient has these following problems, we need to mention it. Even if they do not have any history, we need to mention that there is no history of hypertension, diabetes mellitus, bronchial asthma, tuberculosis, thyroid disorders, jaundice, epilepsy, or cardiac illnesses. And then we'll talk about any surgical history, or has there been any major accident in the past. And last but not the least, any history about blood transfusions, and if yes, whether if there was any blood transfusion, then whether there was any transfusion reactions or not. Then comes the personal history. So first point in this is who he lives with. Like the patient lives with his wife and 2 children. Next is the diet that the person consumes, and the appetite, sleep pattern, bowel and bladder habits. And last but not the least, the substance use. So for the substance use, we have to talk about tobacco chewing, smoking, alcohol, and all these need to be in detail. If someone chews tobacco, so how many years, duration, and what exactly do they smoke or drink, how many times in a month, how many times in a day, how many years, everything, all details about all that. And regarding the diet, just saying whether the patient consumes a non-vegetarian or a vegetarian diet is enough. And but when we think that we are seeing a patient of uh, oral ulcers or oral carcinoma or gastritis, we might need to specify whether person consumes has a habit of consuming spicy diet or not. And let's say we suspect that by the history this person could be a case of stomach carcinoma, then we can also ask things about whether this person is used to eating smoked food or not. And if the appetite is normal, we just say the person has normal appetite and sleep pattern is undisturbed and bowel and bladder habits are unaltered. So that is all for the personal history of the patient. And for females, menstrual and obstetric history is important. So for the menstrual history, what we need to mention is the menarche, the last menstrual period of the patient, the number of days of menstruation, like for example 4 days, the length of cycle, like 26 to 30 days is written as 28 plus minus 2 days, and whether there's any associated dysmenorrhea, and number of pads used per day during menstruation, and whether this cycle is regular or not. But if the patient has already attained menopause, we can just talk about when she had attained menarche and when did she attain menopause. And if all this were during the normal time, and like menarche at 13 years and menopause at 45 years of age, we need not mention anything, and we can just say that this patient had an unremarkable menstrual history. There was nothing odd. But if something was odd, like a very late menarche or early menopause or something like that, then we can specify and talk about it. But sometimes, let's say you are taking a history of cholecystectomy, cholelithiasis, and or appendicitis, or for a headache and all, and you did not go into much detail about it if you think it's not important. And then comes obstetric history. I'll just write an example of this. Then like so, 10 years NVD male child, 5 years NVD female child, 2 years lower section lower section cesarean lower segment cesarean section male child. So by this obstetric history, I get to know that 10 years back there was a normal vaginal delivery and the child was male. Then a female child was born by normal vaginal delivery again 5 years back, and there's also been another delivery by surgery 2 years back, and that was a male child. In the family history, if it's not remarkable, we can just say that there is no significant history of medical illnesses in the family, or no history of any significant medical illnesses in the family. So here what we want to know is any history of congenital or hereditary, not exactly congenital, but more of hereditary conditions and communicable diseases. Let's say father-in-law of the patient, whether father-in-law has any diabetes or hereditary condition or cancer, it's not very relevant. But in the same bloodline, it's very important. Like if the patient's own father, mother, uncle, or aunt, they have any hereditary conditions or carcinoma, that's important. In the and if there's a history of tuberculosis or let's say COVID in the people who are living together, whether it's parents, father-in-law, mother-in-law, or brother-in-law and all, that's important if it's a communicable disease. And if all these are not present, then we can just cut it short and say no history of any significant medical illness in the family. And before doing all saying all this, we have to draw a pedigree chart of the family. Socioeconomic history, we need to mention whether the person lives in a concrete house or a non-concrete mud house or something like that. What we want to know is if there's a proper sanitary latrine at home. What kind of water do they drink? Do they drink water directly from the river, well, or tap, or after boiling it, or do they drink packaged water? And whether we just want to know whether they maintain hygiene and cleanliness. Next, we want to know per capita income. Per capita income means that if the total salary of the family is 1 lakh rupees and there are 5 members, then per capita income is 20,000 rupees. So we just say the per capita income is 20,000 rupees. We don't need to keep mentioning that they earn this much and there are this many family members. Drug and allergy history. Drug history means medications. Like for example, a person could have had chemotherapy, received 4 cycles of chemotherapy in July 2021. Or for example, a person has been on oral hypoglycemic agents for the past 10 years, and insulin therapy has also been added for the last 6 months. We can tell what is the tablet that this patient has been receiving and what is the dose as well. For allergy, we need to mention whether the person has any history of allergy to any medication or food substance, and if there is not, we can just say that there is no known history of allergy to any drug or food substance.